In today's video, I will discuss a very important topic that has affected millions of people around the world. Yes, it is paralysis. No doubt many people are living with paralysis and they find their lives to be difficult to manage. Their everyday activities and routines are affected. Not only do they feel physical pain but emotional too. So, in this video, you will explore what paralysis is and how it occurs. So let's jump into the topic. Paralysis is a loss of ability to move or control muscles. This happens due to damage in your central nervous system, meaning your brain and spinal cord. Okay, let me make it more clear to you. When your brain or spinal cord gets damaged due to an injury, trauma, or certain autoimmune disorders that target your nerve cells, the message to move your muscles cannot pass from your brain to your muscles, and hence your brain cannot process the movement and loses the control over your muscles mobility. This is what called paralysis. Okay, let's have a closer look at how paralysis happens. See, your central nervous system is basically your brain and spinal cord, which is responsible for sending and receiving messages to and from rest of your body. These messages travel your nerve tissues to instruct your muscles to move. In case any harm or injury happens to this part, it can disrupt the communication between nerve cells and leading to loss of sensation and mobility. Since it is a neurodegenerative disorder, it can affect any part of your body, be it the face, mouth, or limbs, depending on the severity and the cause. Well, a major fraction of the population is struggling with paralysis and finds daily unrest and difficult living. Do you know 1 out of 50 Americans are dealing with paralysis? I mean, almost 5.4 million people are living with paralysis in the US. If I give you global data, then this number can rise to 100 million approximately. So, paralysis is now a common brain disorder that requires immediate clinical supervision. As we have already discussed, paralysis occurs due to damage to your nervous system. But how does this damage happen? I mean, what are some contributory factors that lead to the development of paralysis attack in a person? Alright, so let's talk about its causes. The first factor responsible for causing paralysis is spinal cord injury, SCI. No doubt, spinal cord injury is one of the leading causes of paralysis in the world. This can happen due to accidents like car crashes, falls, or sports injuries. Almost 15 million people are living with a spinal cord injury worldwide, and most of them have experienced paralysis attacks. So, when your spinal cord gets damaged, the signals from the brain to the muscles are happen, leading to the loss of movement of the particular part. Now, I will tell you the second reason. It is a stroke. I think it is a very common cause of developing paralysis. A stroke occurs when the blood flow to a particular part of your brain is interrupted, either by a blockage or a rupture. This lack of blood supply to the brain can lead to less oxygen and nutrition, causing damage to brain cells. This damage results in paralysis, especially of one side of your body. Alright, the next cause of paralysis is cerebral palsy. Is a group of neurological disorders that affect movement and posture. This is a congenital brain disorder, meaning it develops during or before birth. Around 18 million people have cerebral palsy, and most of them might have experienced paralysis. Do you know certain autoimmune disorders can also be the cause of paralysis? Yes. Autoimmune disorders like multiple sclerosis can also be contributing factor in the development of paralysis. Multiple sclerosis occurs when your immune system attacks the nerve cells in the central nervous system, leading to damage of nerve tissues. This autoimmune triggered damage hampers the transmission of signals from your brain to the other part of the body, thus causing paralysis. Traumatic brain injuries can also be a potential cause of paralysis, as almost 69 million people are living with traumatic brain injuries, TBI. Hence, TBI can also be a major contributing factor. Well, TBI is an injury to your brain caused by some external forces like a sudden fall or a violent blow to the head. It leads to a damage the part of the brain that controls the movement. Alright, paralysis can also occur due to several neurological disorders such as amyotrophic lateral sclerosis, ALS, spinal muscular atrophy, SMA, and Parkinson's. These conditions occur due to degeneration of the nerve cells, causing a loss of control over muscles and eventually leading to paralysis. Well, certain infections like acute flaccid myelitis or genetic disorders like muscular dystrophy can also be a cause of paralysis. These cause muscle weakness and paralysis over time. I have discussed what paralysis is and how it develops. I know living with paralysis is already tough, as it not only hampers your mobility and postures but also lead to emotional trauma. Relying on traditional medicines cannot work in the long run and even cause other side effects. Well, paralysis can easily be managed with homeopathic medicines. Yes, homeopathic medicines are holistic and treat patient inside and outside without compromising your health. These medicines are given in small sugar pills which are highly potentized and start acting on the whole constitution, giving you relief in physical and psychological symptoms. Well, at Bharat Homeopathy, we have treated thousands of patients with a clinical history of neurological disorders. We prescribed them a personalized homeopathic treatment after proper case taking. Now, they have fully recovered from their paralysis and are leading healthy life again. No doubt, your paralysis can effectively be treated with the holistic touch of homeopathic treatment. If you want to know more about the treatment, you can feel free to call us and talk to us today. I hope you like this video. Please share it with others who might benefit, and don't forget to subscribe the Bharat Homeopathy YouTube channel for more such health related videos. Thanks. Have a great day.